Poverty, crime, gender-based violence, load shedding, cholera, the list goes on, all part and parcel of everyday life in South Africa. And those most vulnerable in our society are impacted heavily by all of these issues. And children are carrying a very heavy load, sometimes unseen load. And according to child specialist groups and academic groupings, high levels of adversity increase children's risk of developing mental health issues. And the vast majority of our children and young people are also unable to access help or diagnosis. Let's talk some more about this almost silent crisis. I'm joined by Professor Crick Lund from the UCT Centre for Public Mental Health, and he joins us virtually from Cape Town. Prof, thank you so much for your time this morning and for lending us your expertise, talking, of course, on behalf of a large grouping of specialists, including the Children's Institute in Cape Town. Now, nearly a year since the publication of that institute's South African Child Gauge, I think it was. We spoke about it at length last year when it was released, and it painted an alarming picture of the state of care accessible for our most vulnerable in society. And yet our children continue to be exposed to extraordinarily high levels of adversity on a daily basis. I mean, we bring the news to the nation every day, and one can almost forget that on the peripheries of the scenes that we're showing people of a crisis in a community are children that are experiencing this, are watching it all unfold. What kind of impact is poverty, crime, public violence, and even the scourge of gender-based violence having on the mental health of our children?
Yeah, good morning. Thank you. So we know very clearly from the epidemiological research that poverty, crime, violence, gender-based violence especially, all have a negative impact on children's mental health. We see the children who are exposed to these adversities have increased prevalence of depression, anxiety, and into adolescent substance use problems. So there's a very strong correlation between these social adversities that you've been describing and worse mental health for children. And that has a knock-on effect because it affects their ability to engage in education, to later find employment. There's a very clear documented correlation between adolescent depression and anxiety, for example, and reduced employment rates later in life. So this is not only something which has an impact on children's mental health, it has an impact on their ability to function in society. This is really what the South African Child Gauge was drawing attention to and really provided a very comprehensive report of the evidence about all of these social and economic drivers of children's mental health.
Let's talk numbers then. I read there that only 15 child and adolescent psychiatrists who are working in the public health system. That's mind-boggling if you think of the workload that would involve, with 9 in every 10 children with a diagnosable mental disorder unable to access treatment. Why is that number of specialist psychiatrists so low, and how key would it be to increase that number?
Yeah, so the number is extremely low because of historical undervaluing of mental health. And mental health is very low on the priority list of the Department of Health. And it's taken a long time to get mental health policy adopted in this country. This is so in countries around the world. Many countries don't prioritize mental health adequately. And through the COVID pandemic, we've seen a huge increase in awareness of the importance of mental health and the impact of things like COVID on population mental health. So these are the reasons why we have so few mental health specialists, including child and adolescent psychiatrists, psychologists, mental health nurses, and so on. If we just take the example of training for clinical psychologists, we have only 8 positions every year trained at the University of Cape Town in clinical psychology. And this is not due to a lack of interest. We have over 200 people applying for those 8 positions every year. So the problem is that we don't have enough training posts and we don't have enough funded positions in the public sector to provide the mental health care that's needed. I want to just also add that it's not...
Sorry, please go ahead.
I just wanted to add that it's not only about not having enough mental health specialists. I think there's good emerging evidence from research that we and other colleagues have done on the potential for a task-sharing model where mental health specialists train non-specialists including community health workers, primary healthcare nurses, school teachers, in the basic detection of common mental health problems among children and adolescents and the referral to the right level of care. Even the provision of basic counseling has been shown to be effective. So it's about changing the system. It's not only about training mental health specialists. It's about shifting their role to becoming trainers and supervisors of other non-specialist health providers and social care providers.
And of course, increasing the ears and the eyes in the community that can really pick things up where children most need somebody to look out for them. So, sadly, we've run out of time, but I'm sure we'll continue this conversation. Professor Crick Lund from the UCT Centre for Public Mental Health, he and his colleagues continuing to do such important and strategic work in the sector as we try and improve how we are best able to support those most vulnerable in society. We thank him for his time this morning.